shaped chest, hyperinflated lungs, tubular heart, you're there. It's COPD. And if you take it 2D echo, you may find changes of the carpulmonale. Carpulmonale is right ventricular hypertrophy, right ventricular enlargement, or right ventricular failure. Patient may come with right heart failure and JVP raised and all this stuff. So carpulmonale is a heart disease secondary to pathology in the lungs.
What is the role of lung transplant in chronic COPD patients or pulmonary patients?
That's again a very intelligent question. Let me say that yes, chronic obstructive pulmonary COPD, non-risk patient has severe hypoxia, patient requiring home oxygen. He cannot take out the oxygen even for going to washroom. So he is totally 24 hours oxygen dependent. His lungs are become stiff. He cannot. You cannot see the chest movements also during those. For these kind of patients, lung transplantation is the cure. If you transplant the lungs, you can give a permanent cure for these kind of chronic refractory COPD patients. That's a good question, right? Okay, I think that is all for today. Please read about these two diseases, very interesting diseases, and remember what I say. Some students here are noting down some points. Go home and read and be familiar with these two things. There should not be any doubt in your minds about what is this and what is that. In a given patient, tomorrow if a patient comes, you have to diagnose what is it. Is it asthma or COPD? It's very easy if you really understand. As a student, I used to have a confusion. I used to have I was afraid of making a diagnosis. But now things are very, very clear. Everybody is understanding the mechanism pathology. So it's easy for you to diagnose both these conditions. And treatment-wise, almost they're almost same. So with this, I think I thank all of you once again. My team here, my students here, and my students all over the world. I think there are a couple of students from USA today joined, and Kyrgyzstan. Thank you very much, all of you, for joining, and see you tomorrow for the next class tomorrow. Till that time, thank you very much, and bye-bye.
Can we make out barrel shape chest on inspection?
Yes, that's again a good question. Barrel shaped chest, can we make out on inspection? Yes, we can make out. Yes, many times it's very common. You can see so many people in the hospital. One COPD patient, barrel shaped chest. You can see. You can. That's why the measurement of the anteroposterior diameter, and I'll show you. Come here. Come here. There's a method to measure the measurements of the anteroposterior and lateral diameters. Do you know? Do you know? Come here. Can you tell me? How do you measure the anteroposterior and lateral diameters of the chest so that you can suspect COPD in the beginning? In COPD, the anteroposterior diameter increases. The ratio gets reversed.
So we place two cardboard books along the posterior and anterior side.
Yes.
And at the level of the nipple or
yes.
We place the biggest and measure the exact.
Yeah, I'll show you. Can you hold the mic for me? Yeah, can you hold the mic for me? Okay, now we can take a book or even X-ray film. You can take an X-ray film. Can you all see? Take an X-ray film. Take an X-ray film. Keep one in the front and one in the back. Raise your hand. Keep one in the front. You measure the distance, right? This is anteroposterior. Simple. This is anteroposterior diameter. You can keep two books or two X-ray films and measure this properly. This is anteroposterior, and this is the side to side. You can measure. Hold that.
Yes, sir.
Hold that. You can measure this distance. This is the side to side. Very simple. So you will know whether you are dealing with normal chest or barrel chest. Okay, I enjoyed teaching today because there's a lot of things that I could tell you. I'm happy that you're all there. Thank you very much. Good night. Again, bye-bye.